It's been called a hidden epidemic. More than 100,000 adults in Hawaii have diabetes, with another 400,000 on the verge of being diagnosed. Diabetic patients are also at a higher risk for infections, so this is an especially vulnerable time during the COVID-19 pandemic. From managing blood sugar levels to medical treatments and prevention, our panel of experts will break down this health crisis. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Daryl Huff. Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. This causes sugars to build up in your blood. It's estimated that 119,000 people in Hawaii have been diagnosed with diabetes, 410,000 are considered pre-diabetic, and another 39,000 do not know they have the disease. Our panel tonight will take on all aspects of this significant health crisis, from who's the most at risk and what we as a community and individuals can do about it. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Dr. Lori Tom is an endocrinology, diabetes, and metabolism specialist. She graduated from the John A. Burns School of Medicine and is the past president for the Hawaii chapter of the American Diabetes Association. Dr. Marjorie Mao is a professor in the Native Hawaiian Health Department at the UH Med School. She was the first woman from Hawaii to be recognized as a master physician by the American College of Physicians. She's also a principal investigator and director of the Center for Native and Pacific Health Disparities Research. Dr. Mariana Gershenson is the director for the Diabetes Research Center at the University of Hawaii. She is also the associate dean for research and a professor at the UH Med School. For the past 30 years, she's been an international leader in the field of pediatric and adult cardiovascular and metabolic complications. And Tony Lee is a diabetes patient. She was diagnosed with adult-onset diabetes in 2004, but through diet and exercise was able to get off insulin in 3 years. Tony, let me start with you. What was the first thing that told you you might have a problem with diabetes? How did you find out that you had it?
Well, my husband had diabetes, and he passed away at the age of 47 years old. So I knew what symptoms were like, but he was diagnosed at the age of 20. So most of our life together, he was a diabetic and he was on insulin. So while working, I noticed that I was drinking more water, feeling okay, but wondering if, going to the bathroom more, wondering if, are these symptoms of being a diabetic? However, really didn't worry too much about it because nobody in my family had had diabetes while I was growing up. So I thought it had escaped us until my kid brother became a diabetic before me. And I was like shocked. And then I was educated by Dr. Wong, Nathan Wong, and saying to me that, sometimes it skips a generation. So it might have been in your family, but you just didn't know about it. And he died very young, my brother did, and he was very fit, tall, lean, not ever overweight. Very
let me ask Tony.
Right thing.
Sorry, let me interrupt you to go to Dr. Tom now. Doctor, is this kind of the story you see all the time? I mean, it seems like it's not obvious to people right away that they may be getting it, and they're looking for clues. Is that a fairly typical story of how people discover that they have it?
I think that we definitely know what the risk factors for diabetes may be, which includes a family history, but also certain ethnic minorities, just getting older, if one is overweight or obese, if one's had diabetes in their pregnancy, we know that those are risk factors. But once patient starts to have symptoms, so again, increased thirst, urinating frequently, losing weight even though you're eating, blurry vision, cuts that don't heal well. So those are the physical signs that might clue you in that you might have diabetes.
And from what Tony Lee was saying, it sounds like it can shorten your life. If you, I mean, it sounds like they knew that her husband had it for a fairly long time, but still, death at 47, her brother. Do you see people dying from this disease often early in life, and how frustrating that must be to you?
Well, the good news is, a generation later, nowadays, we know a lot more about diabetes. We know how to manage it and control it. And so our messaging in part is if we take care of our diabetes, we are going to prevent the complications of diabetes so patients can live a long, healthy, and productive life. So that's really the goal.
Dr. Bao, we talk about the ethnic background. I know that's sort of your field. What makes one ethnic group, particularly Native Hawaiians, more susceptible to this? Is it actual genetics of being Native Hawaiian, or is it other factors in lifestyle and so on?
Right. So thanks for the question. I think we're learning more about the origins and underlying causes of why people are more susceptible to diabetes. And there's some recent research that's been done looking at genetic predispositions here in Hawaii's diverse ethnic populations. But what Tony's story was really important is that it's not known for diabetes to get it from another spouse, an unrelated individual. But what it does say is that people who live together often live in the same lifestyle, the same environment, eat the same kinds of food. So even if you have a genetic predisposition, the environment is incredibly important in terms of whether you actually develop diabetes, both good and on the negative side as well. Most people don't die of diabetes itself. They usually succumb to some complication,
Right.
Heart disease, for example, or kidney failure or something like that. But my suspicion is that, how we live our lives together in our families, in our communities has an incredible impact on, how our lives are. And like Lori, Dr. Tom said, is that we have developed more therapies. We understand more about the correct combination of medicines if you need more than one. And we have more medicines that are not insulin, but injectable, that are very, very therapeutic in bringing the sugars down.
Dr. Gershenson, I notice you have a lot of expertise in pediatric diabetes and so on. What's the difference between, we hear about diabetes 1, diabetes 2. Is there a difference between children who get diabetes and adults that get diabetes?
There is a difference in what we think of classically, sort of like what I think of as old school is type 1 versus type 2 diabetes. And type 1 is typically in, as children. And what happens is that your pancreas doesn't make insulin. Your immune system actually attacks the pancreatic beta cells. And so you don't have the ability to make insulin, which is very different than a type 2, where there's a decrease in the insulin production. And that's due to aging, that's due to a lot of different reasons. But now, for instance, what we're seeing, one of our physicians, Mayo Kahiro on the Waianae Coast, especially with COVID, that kids are sitting at home and they're on the screen and they're eating and stuff. We're now seeing an increase in type 2 diabetes in children. And there's actually a whole field of research, multi-site studies looking at children to see how well they do on the medications that the adults take. Because unfortunately, children who are type 2 diabetics don't do it. They can't take the same medications as the adults do. So it's very scary that we're now seeing an increase in weight in children.
Dr. Tom, have you seen that? You have more patients coming into your practice, or I know Dr. Mao. I know you also work with patients. Are you guys seeing more kids coming in, and is it usually obesity that brings them in?
Well, I have an adult medicine practice, so I'm not seeing them, but of course, I'm aware that the type 2 diabetes in children is increasing more than actually the diagnosis of type 1 diabetes in children. But I did want to say that as children are getting more type 2 diabetes, you can get type 1 diabetes in adulthood. So we call that a latent autoimmune diabetes in the elderly. But the rates of diabetes in children are increasing, and again, the high-risk ethnic groups are those affected most.
You know, Tony, as a native Hawaiian yourself, how do you think? Why do you think you got it? You mentioned the genetics, skipping a generation and so on. Do you think, looking back, that perhaps your lifestyle or your diet had something to do with it?
Sure. I've worked my whole life. And as I got older, I gained weight, but it seemed to have happened in my whole family genetics. On the women, that we were very thin when we were young, and then from age 40 till now, and I'm 79, that we're kind of on a heavy set, and then the weight started to decline. So I'm sure the weight had something to do with it. And of course, working long hours, I always worked over, 13, 14-hour days for the military. And, not really taking care of yourself. So,
but you look,
you look
great. We're glad to have you with us. You look terrific. Dr. Mao, let me ask the question from a viewer. Are there any foods or diets that could lead to diabetes? Is there any particular thing that you'd like to point out as a factor when it comes to diet?
Well, maybe let me flip that around a little bit. We know that diet and exercise, lifestyle, if you will, is the first line medicine for preventing the onset of diabetes. And that's what the Diabetes Prevention Program showed back in 2003. And now there's a lot of diet programs and lifestyle programs out there that are based on that scientific study. So definitely nutrition and dietary intake is important, but there's no such thing as a diabetic diet. There's no such thing as a diabetic diet. Everyone who's living with diabetes or pre-diabetes should eat a well-rounded, healthy diet, watching out for fats and total number of calories and so on and so forth. And like I always like to say, it was amazing because that study showed that what we can do as individuals living our lifestyle is more powerful than a pill, which was the other treatment that was tested in the DPP. So we may go to, doctors like Dr. Tom or myself and say, okay, give me something that's going to make this go away. But actually what you do in your own life day to day is more powerful, at least in this study, more powerful than a pill to prevent the onset of new diabetes.
Let me ask Dr. Gershenson, in the research now, why is it that exercise helps? What is it when you exercise that would help you prevent something like diabetes from coming on?
Well, one of the things we know in the pre-diabetes state is that there's increased inflammation, there's increased free fatty acids, and when you're losing weight, you're decreasing the amount of fat, and you're decreasing the amount of fat that's also that's being stored in your skeletal muscle, or that it's in your muscles, or that's being stored in your liver. And that's not good. So when you're losing weight, that's what is helping. And it's not a lot. I mean, we the clinicians will tell you that 5-10 pounds, I mean, that helps. And it is possible, as you're hearing, from Tony, that you can lose weight and get off insulin. I mean, I've seen it more than once. And I know that losing weight is hard. I mean, that part, and exercising, is hard, but that really is the prevention and the cure. Now, as you heard Dr. Tom said, and you heard Dr. Mao, we have great medications. I mean, things have changed so much in the last 20 years and in the last 10 years. I mean, we have great drugs. And to give one last thing is, we now do have one drug class called the glucagon-like peptides that have been approved by the FDA. They help with diabetes, with increasing eating insulin from the pancreas. But the other thing that it does is that the FDA has approved it as a weight loss drug in 2019. So there are options. I mean, for losing weight, typically, if you're not going to exercise and diet, and if you're quite ill, then your choices are bariatric surgery, decreasing your stomach, or in now there's a medication. And I know that endocrinologists are considering the use of that. It's very expensive.
Okay, let me ask Tony Lee, how did you manage to do it? Did you what was it like psychologically and emotionally to have diabetes, be on insulin, and then work up the will to actually change? What did you have to change? What did you have to do?
The first thing, let me say that for me as a diabetic, the horrifying thing that I worry about is, number one, becoming a patient on dialysis. Secondly, being an amputee. Those things to me are really frightening. And I was very thankful that my husband didn't have to go through that, even being as long as diabetic as he was. So when I was told, and by the way, I was diagnosed on a ship, on a convention for the Hawaiian Civic Clubs. And the Hawaiian Civic Clubs started, my husband and Dr. George Mills started a program with the Hawaiian Civic Clubs to help Hawaiians to go through a health screening program, so that many Hawaiians don't have medicals, and so this way they could get their blood tested and all of that, and all of those things that they did were given to them to take to their doctor. Well, as the convention started, as a leader, and in fact I was running for president that year, I went to entice people to go. As a leader, you gotta go so they follow you, right? So I went right up and took my stats, and Dr. Kalani Brady, who was our doctor on board, said, "Did anybody ever tell you that you were a diabetic?" I was like, "What?" Now, as I told you, I kind of had thoughts, but you know how you just kind of push it off to the side and say, maybe not.
Let me.
So he said, when you get off this ship, you go straight to your doctor and get tested right away. And I tell you, we ended on a Sunday, and I was in emergency, and I was about an hour, and went and got tested. And they said, "You're definitely one, and we're going to put you on insulin 3 times a day." And I was like horrified. Horrified.
I'm going to stop you,
Got my
Tony.
attention.
Tony, we're going to pick up this story a little bit later on. I want to talk to Dr. Tom a little bit. How successful are people in beating diabetes these days? I mean, we talk about drugs, we talk about lifestyle. I mean, with the adults that you're dealing with, how often do they have a success story like Tony's?
Well, I think part of Tony's story may be that at the time she was diagnosed, her sugars were really high. So the most effective treatment at that time would have been insulin. And so as you're educated, you change your diet and the blood sugar comes down, you're able to get off of insulin. And I wanted to say earlier about exercise. Aside from the weight loss, exercise helps the body be more sensitive to insulin, because one of the problems in type 2 diabetes is insulin resistance. So exercise helps insulin sensitivity, even if you don't lose weight. So exercise is a good thing for many, many other reasons as well. So I think nowadays, actually, there are many medications we can choose actually before having to use insulin. So that's kind of the current trend. Diabetes does tend to be a condition where we do use a lot of medications in conjunction with diet and lifestyle.
So back to my original question. I mean, do most people end up having to maintain a certain level of health with all these medications for the rest of their lives, or do many of them actually manage to get to the place where they don't need that much intervention?
So early on, many people are able to manage with diet and lifestyle, but diabetes is a progressive condition. So most people will end up needing medications, and maybe as many as 50% after decades of diabetes may actually end up needing to take some insulin, because part of the disease is the pancreas does not make enough insulin. So replacing that natural hormone of insulin is part of the treatment.
Let me ask Dr. Mao, a few years ago, there was so much talk about diabetes. It was an epidemic. We've got to do something. Actually, we've just had a year-long pandemic. It's still going. So, obviously everything else has been pushed out of the public mind. Kind of probably good we're doing a show like this to remind people that there's other things that they need to pay attention to. But how much have we had any success in fighting this epidemic, or is it still growing in Hawaii?
Are you talking about diabetes or
Diabetes,
COVID?
yeah. Diabetes,
Oh, okay.
yeah.
Because we had two things going on. And actually they intersect, as you all know. Individuals who are living with diabetes are susceptible to some of the most serious complications of COVID-19. Lori's, right. For years and years, I flew to Molokai and took care of many of the individuals who were afflicted with diabetes on Molokai. And I spend most of my time now working with folks like Mariana to understand what's causing diabetes in individuals, and especially our Native Hawaiian Pacific Islander individuals and communities. And I'm now turning more of my effort to prevention, because despite all the great therapies we're doing, diabetes prevention has to be where we start. And it should start in our young people, because once you have diabetes, it's not a lost cause, but it is complicated and it does affect every part of your life. And we're understanding more about diabetes prevention and lifestyle and how exercise works and things of that nature. But for me, even if we can prevent one case of type 2 diabetes, we are actually affecting a generation of people. Because if, for women, the risk for type 2 diabetes carries on into pregnancy, and then, the babies are then at higher risk, and it goes on and on and on. So now the good news about diabetes prevention is that we're actually making a difference. The rates of new cases of diabetes in Hawaii and in the US are going down. There are less new cases of diabetes occurring since 2012, actually, and that trajectory is still going down. It's going down slower in other populations that are not white, but the fact of the matter is we are making headway. It doesn't mean that diabetes is gone, because many of us who are living with diabetes are still here. So it's still in our communities, and we still need to care for that. but the number of new cases are going down, and that's good news. That's really good news.
Dr. Gershenstein, what would you attribute that to? Is it overall population health is improving, or specifically people are doing things to avoid diabetes?
Well, I mean, I think that the numbers have stabilized. Like Dr. Mao said, we're now at around 10%, 10.5. What's concerning is the health disparities, because we're still seeing an issue that, Native Hawaiian Pacific Islanders, Filipinos, they have higher, they're at 12%, 13% as far as their rates, at least from the most recent 2020 CDC numbers. So we still have challenges. And this hasn't really been brought up, but one of the things I was going to say, and I'm going to say it over and over again, is it's so easy to get tested nowadays. You don't even have to fast. You can go to CVS or Longs and get a glycosylated hemoglobin A1C test, which is measuring the amount of sugar that's bound to hemoglobin. And it's easy to do. You don't have to go to if you don't have a doctor, you can get tested. So if nothing else, go to the Department of Health site, take their Easy Diabetes test or the American Diabetes Association, figure out, whether you should get tested. Usually if you're younger, it's not the same as if you're over 45, but still it's so easy to get tested. So I really recommend that.
Dr. Tom, what are you seeing among your patients? I know a lot of times when you're a specialist in something, you see people when they're already sick, as opposed to before they're sick with a condition. Do you have success in getting them to turn their lifestyles around? And I'm also wondering, are you seeing a difference in your patient, the people who come to you with the condition?
So when they come to me, they might not necessarily have complications or, as you said, really, really sick, but they might need a little tweaking of their medications, a little bit more, expertise in using the newer medications. So, again, together, I'm a big advocate of diabetes education. I send them all to classes. There's a lot of resources, local classes, and there's no shortage of information on websites. So when they do get educated, that inspires them, that motivates them, that empowers them to make healthier lifestyle changes, healthier diet changes. And I wanted to comment about the decreased rates of diabetes that Dr. Mao mentioned. When that DPP study was published and it proved that we could prevent diabetes, the messaging that went out with that. And as we screen more for patients with diabetes, we're picking up more pre-diabetes. So at that state is where we can take action, because at pre-diabetes, you could maybe reverse it and prevent people from progressing to diabetes. So the best cure for diabetes is really to prevent it.
Okay, I'm getting a couple of questions from people who are challenged by diabetes in some form. One, I'm very optimistic. I'm a pre-diabetic, reversing and changing my lifestyle 2 months now with help of my diabetes dietitian. Congratulations, D, from Facebook. Here's kind of a technical question, and maybe either Dr. Mao or Dr. Tom can help me with this. What I need to understand, will I be free from pre-diabetes if I continue to reverse my numbers? I am 5.7 AC1 since 2016, and I am 2 months into this diet of moving more, eating healthy, sleeping well, and being stress-free. Also drinking a lot of water. I'm scared of type 2. Dr. Tom, could you help translate that for me? I don't know much about diabetes myself, and what would you say about this person's efforts?
So I think the hopeful answer would be yes. So at the state of pre-diabetes, your blood sugar may be high, out of the normal range, but not yet high enough to be diabetes range. So when you're pre-diabetes, you can either stay at a pre-diabetes state, you can progress to diabetes, or you can actually, hopefully with this person, you can go back to normal glucose levels at a normal hemoglobin A1C.
Okay, Tony Lee, let's pick up the story for you now. So you've been diagnosed, you went to the doctor, they gave you insulin right away, and you were horrified. So what did you do then? What happened next?
Well, right away, I sat down and looked at my life and changed it. I, was never one to eat 3 balanced meals, never ate breakfast. So I did. I said, okay, I'm going to change how I eat and ate balanced meals faithfully. Did a little bit more of exercising, but I'm really not an exercise type person. But tried to do, short walks a couple times a day and things, and dropped my weight. Watched what I ate and dropped 35 pounds. So the first year was down to first year was 3 shots a day. Second year was 2 shots. The third year I was down to 1. And after that, I was completely off and only on metformin.
Awesome.
And so far, it stayed the same.
So,
So I'm always horrified when I go, though, to make sure it's not changed.
so you say you're 79 now. You were
Yes.
diagnosed in 2004, so that was 17 years ago or so.
Yeah.
So you were in your early 60s. How hard was it for you to change the way you were living when you're in your early 60s?
Not at all, because like I said earlier, I was deathly afraid of the outcome if it didn't get my attention.
Because
It was
you'd seen
then
the worst,
time
right?
to get-
Because you'd seen horrible things happen with people who had diabetes at that time.
Yes. And of course, we all know that being a kidney dialysis patient doesn't mean that every diabetic is. But the point is, try not to become one, right?
Exactly.
So watch what you eat. Yeah.
Um,
Moderation.
Dr. Mao, in terms of you said there's no diabetes diet, but there's also a big emphasis right now on reducing sugary drinks. And is that something that tends to be part of the risk group's lifestyle? I mean, is there a lifestyle piece that you're particularly concerned about that tends to be associated with the higher risk groups?
Right. So what I've learned, I'm not a dietitian, but what I have learned is that it's good we have dietitians. Because learning how to eat healthy, because there is no set diabetic diet, means that we have to educate ourselves on how to understand what we're putting in our mouth. And so you have to learn how to read the labels. You have to understand what these things are. I mean, half of them you can't even pronounce. And it turns out in the old days, when I first started, doing my endocrine fellowship and medicine residency, the idea about fats, for example, that all fats were bad. That's not true anymore. We now understand the role that fats, different kinds of fats, monounsaturated fats, there are healthy fats and unhealthy fats. And so we have to teach ourselves, we have to educate ourselves, not just because you have diabetes, but because of a lot of health conditions. A cardiovascular disease, which is the #1 killer for people with diabetes, is also affected by diet in big ways. And so I think the message that I'd like to have folks remember is that it's incumbent upon us to understand what we're putting in our mouth. And the more that, we understand that and cook our own food. Actually, in the pandemic, we've all had to stay home, not go to a restaurant. And pretty soon you figure out, I've cooked so many of my mother's recipes this past year than I have in a long time. And they're really healthy, and I think it's just, we have to educate ourselves. And I'm really interested now myself in terms of what I eat and drink. I drink more water than I ever have before, and it's really a good thing.
Dr. Gershenson, this is a question from a viewer. Have they ever studied the radical increase in diabetes since the 1980s? We have talked a little bit about, things maybe a little bit more under control, or a little more education out there, but what caused the explosion in diabetes that we did see?
Oh boy. No, when you look at the graph,
You have
it really
30
started to
seconds. No,
shock.
just kidding. Go ahead.
But no, I mean, I think back to, I grew up in Southern California and we used to exercise, during, and then funding changed, there was less exercise, we didn't sit in front of TVs, we played outside. I mean, we've changed our whole lot, the way that we live. I mean, everybody has an iPad, everybody's connected up to their phones. I mean, it's a complete, that has really changed. Even our diet. And this is true regardless, you look at different ethnic groups, what people eat and the amount that they eat, the size of portions. Go to a Cheesecake Factory. It's like, that's enough for 4 people. A portion is the size of a deck of cards. If you're eating, more than that. And I love what Tony said, because that's exactly what my mother told me. She said, everything in moderation. So I agree, but that's what's contributed to the increase. But it's not, and I do want to make something clear. It's not, being overweight and obese is a risk factor, but it's not the only thing. We just had a study published, last month by the multi-ethnic cohort. I know as a UH News today, showing that, for instance, the amount of subcutaneous fat versus visceral fat that you have. So subcutaneous fat is the fat you have under your skin. And visceral fat is the fat that you have in your organs, your belly fat around your organs. And for instance, that study showed that in Japanese individuals, that ratio, if you have more visceral adiposity, that's associated with an increased risk of diabetes. So it's more, you don't think of someone who's small or someone, diabetes goes across. And Dr. Mao mentioned, we keep talking about Native Hawaiian Pacific Islanders, but I'm Hispanic. Hispanics alone have just a 40% chance of being diabetic. Add a sibling or a parent who's diabetic, that increases your risk to 50% for type 2.
Dr. Tom, I'm wondering, do you sometimes have patients who come to you and said, I didn't think I could get diabetes. I'm not fill in the blank. I'm not one of this group. I'm not one of that group. They don't really realize that they could be at risk if they weren't. I'm just kind of asking whether there's enough misunderstanding out there that people don't think they can get diabetes.
Sure. There are patients that come in, no family history, and they're the first one in the family to have diabetes. But just getting older there's a risk test that the American Diabetes Association has. And as we come upon the end of March, we sound the alert and try to people get to take this risk test. It's a written test, but that's when you can determine what your risk for diabetes is. But you get 1 point for just being past the age of 60. So, and as we get older, so you get 1 point for that. So, and as we get older, we might be more sedentary. So as we mentioned earlier, how exercise helps insulin sensitivity. If you're more sedentary, you're at risk for diabetes. So, we can't prevent getting old, we can't prevent, but we could do something about being sedentary.
Okay, let me ask a question that I'm going to try off of Tony Lee first. Why are there so few self-help support groups for diabetes in Hawaii? Tony, I know that people, when they get an illness, often when they tell other people they have an illness, then you have like 3 people who tell you, oh yeah, my uncle, my brother, my son, you have that kind of social support around you. But what did you do, and what do you do as a diabetic to help other people? What messages do you share most often that people maybe don't expect to hear when they've been diagnosed or they have family members diagnosed?
Well, being a member and very active with the Hawaiian Civic Clubs, we knew early on about the danger and how Hawaiians were, highly tested, and possibility of diabetes was very prevalent. And so I make a conscientious effort to make sure my club members all get tested when they go to convention. We also eat and meet. And when we eat and meet, we watch those diets that what's coming on the table, because we want to make sure that our people are eating healthy. The frightening thing that got once I got off of insulin and everything, my doctor sat me down and said, "It's really good how fast you did this, but I'm worried about you." And I said, "Why?" And he said to me, "Because I don't know that you understand that this is for the rest of your life, not just now. And the fact that you licked it and got control of yourself and your life and your diets, don't think that you're home free. This is for the rest of your life." And that was kind of scary as well. So I try to share my story with whoever will listen. And, it's always best in the lunchroom, right? I'm still working. I'm a teacher and a coupon in the program. And that's the best place to talk about it. And we always have, good conversations about it. And again, I was one of those, like Dr. Tom said, I was thought I was inevitable, that I was never going to be it because nobody in my family was a diabetic. And here I was now, full-fledged, blown diabetic. Right?
Doctor,
Most people start at one insulin shot a day. I had to start with 3.
Dr. Mao, on that question about the self-help and support groups, I know that there have been some diabetes programs that did involve social interaction to promote exercise and other healthy features. How important is it that people talk to each other about this and get together and communicate one-to-one about this to help educate people? Dr. Mao?
Oh, sorry, I thought that was Dr. Tom. Lori can answer that too.
Yeah.
Sure. Well, I was just thinking in terms of our new approaches to help care for individuals living with diabetes. There's this thing called social determinants of health now. And it's part of the way that physicians are being trained to understand the complexities of what it's like to live with diabetes, because unfortunately, there's no cure yet. And it is a lifestyle issue. So it's a lifelong lifestyle issue, as Tony was mentioning. So I do believe that because it's a lifelong condition, having others who can support your efforts to be healthy and well, and not just healthy absence of disease, but well-being, thriving. That's just because you have diabetes doesn't mean you have to limit everything you do. There are some, like I said, education goes a long way. And having a supportive environment, having choices in your supermarket that are healthy, having the ability, safe place to walk, or lights on a tennis court so you can actually play tennis. These are things that are in the places where we live, work, and play that actually make a difference. And so I would say social support is part of that, whether it's coworkers or family or friends or neighbors. And I think people, when you say you have diabetes, I think, people try to feel like it's a stigma. But in the Native Hawaiian community, what I've learned is that if you just talk with people, there are a lot of individuals who are living with the disease, and they're making do because, Hawaiians are resilient. We must go on, and but I would say that, some of the research that is being done in Dr. Gurchensen's Diabetes Research Center is trying to help us understand how, some of the underlying mechanisms, so we can make some advancements in understanding how to prevent the disease and how to better prevent end-stage kidney disease, for example, or end-stage complications. So social support, we can never discount that. So important, in my opinion.
Dr. Tom, do you find among your patients, is there indeed a lack of support groups, or is it more family support that they tend to turn to?
There definitely is not enough support groups. Certainly the family can be a support to someone with diabetes. Sometimes they're actually a barrier to maybe healthy eating and healthy lifestyle. But I wanted to say that the American Diabetes Association does have an adult support group that meets regularly. And they bring in special speakers, whether they be dietitians, pharmacists, and so forth. So I would use our local American Diabetes Association as a resource for what other programs that we have out there. There's a camp for children with diabetes. And, we had a lot more going in the old days pre-COVID. And COVID kind of shut down a lot of the programs. And actually, Tony remembers, we were about to have our annual walk. And that week, should we do it? Should we not? Should we do it? Should we not? And in the final hour, that live walk at Kapiolani Park turned virtual.
Tony Lee, what did you do to inspire yourself to? I know you talk about the fear of advancing with diabetes, which is certainly understandable, but also how did you manage to get more active? I know you said you weren't an exercising person, but what kind of things did you do? I was thinking about people that I've known, older people whose lifestyle is very sedentary. They putter around their house. They don't really get out much. I mean, what did you do to inspire yourself to get moving?
Well, as a very active person in the community, Hawaiians, and being a Hawaiian, we have a lot of kuleana, a responsibility. And my motivation is to stay alive as long as I can and be healthy, because I want to help Hawaiians to become better people, better citizens, be educated, be healthier. And to do that, I have to motivate myself to better myself and do something about it. I don't have time to putter around my house. I wish I did. There is no time to do that. And as I tell my children, the word retirement doesn't exist. So get over it. But there's a lot of work to do to better make Hawaii a better place. And that's my goal.
Dr. Gershenson, we did get another question here about the relationship between diabetics and COVID. Can diabetics get the COVID vaccine? That's the first question. Although I know that today the health department did open up chronic conditions as one of the eligibility factors for getting a vaccine. They didn't say diabetics could break out of the age factor, but they did say people who are on dialysis could. So the question is, can diabetics get the COVID vaccine? I think the answer is diabetics aren't higher in the line right now than other people with chronic illness. But is there an issue with their immune system? Can you just talk a little bit about the relationship between diabetes and COVID?
Okay, that's a little complicated. So first of all,
you have 30 seconds. No, just kidding.
Very briefly. You have to realize in the last year, at the medical school, our physicians have been taking care of patients. We're still open. We've been essential. So we're still teaching medical students because we need physicians. I mean, those are two things we didn't sort of talk about. But one of the things with diabetics is you need access to good food and you need access to medical care. And that affects, that also affects diabetes. But back to COVID. So there's a couple of issues. I mean, the issue with COVID is, first of all, the biggest association has been with obesity and being overweight, and also with aging. So diabetes sort of goes along parallel with that. The issue with diabetes is that there's a couple of different thoughts. One is you have the cytokine storm, and everyone's heard about that. Well, with diabetics, and even pre-diabetics, they have increased inflammation, and that increased inflammation and increased ability to coagulate, in other words, to clot their blood. What ends up happening is now you throw COVID into the mix and it makes it more difficult to fight it off. So it's a toxic combination. Now, people are trying to understand what's going on with diabetes. One of the things that's being looked at is whether or not COVID is attacking the beta cells in the pancreas that make insulin. But again, there's a lot of that we don't know yet, because we've spent so much time now building up testing. So at the medical school, we set up a lab to help testing in the state. We're testing out at the Waiʻi coast. We're testing on the islands. So all our energy has been put on testing, and now all our energies at the medical school are being put into vaccinations. So, and then funding for the research. So right now we have one grant, believe it or not, from the Hawaii Community Foundation that Axel Lear has to look at the immune system pre and post vaccine, but that's in mice. We have a bunch of grant applications that are all out. We are all writing applications to get funding from the federal government, but it takes the federal government anywhere from 6 months to 2 years to fund grants. And so we're sort of behind in the literature, as far as where things are moving overall.
Okay. Thank you. Dr. Tom, another question from Beverly in Honolulu. Again, her A1C is 5.7, has been as high as 6. My doctor says that once you are diagnosed as pre-diabetic, you are for life. Is that true, or can you reverse that? And it's what Tony said, her doctor said, you've got this for life. Is that exactly true, that if you are pre-diabetic, you're going to sort of be pre-diabetic for the rest of your life? You will always have that danger of falling into diabetes, or is it something that you can make go away?
Okay, I'm going to say a quarter of people can make it go away, and half of the people will stay pre-diabetic, and the other quarter may progress to diabetes, just as a simple number. So I'm going to tell Beverly she has a chance of making it go away and getting her numbers down. And but again, ongoing is the need to have a healthy diet and lifestyle, and whatever she did to make it go away, to continue what she's doing.
Dr. Mao, maybe you could help me with this. I'm a little bit lost on this one point. So diabetes comes from either you're not responding well to, your insulin isn't working that you have, or you're not producing insulin. But those sound to me like something that is permanent. Maybe I'm misunderstanding how that mechanism works.
Yeah, so you have insulin resistance, and then you have a beta cell problem, meaning that you have difficulty secreting out enough insulin to bring your sugars into normal. And when that happens, then you get diabetes. So you need two things. Those two metabolic things happen before you can be diagnosed with diabetes. In the diabetes prevention program, where we've been following individuals, and there's about 70 or so here in Hawaii that are part of the multinational, multi-site study. We've been going on now for about 27 years or so. So most of the DPP individuals, and we're just following them now because we already know that you can prevent the onset of diabetes with a healthy lifestyle and modest weight loss of 5 to 10%. So if you can maintain that 5 to 10% weight loss over a lifetime, you're amazing. You're amazing, because in the line of work that I do, it's really not that hard, relatively speaking, to lose initial weight. It's trying to keep the weight off. That is really the challenge, because most people after 1 year on the most effective weight loss program, they're back to where they were. So keeping that 5 to 10% off, you have a very good chance, Beverly, of always being at risk, but not diabetic. In the DPP, since we've been following these people now for over 20 years, the majority of individuals actually have developed diabetes. So there are a minority of people in the DPP right now, outcome study where we're just following them, who have maintained pre-diabetes. They've been pre-diabetic for over 20 years.
But let me understand though, and we're kind of running out of time, so I just need a sort of quick answer to this question. Once your insulin is not working that well for whatever reason, you can't make more insulin except by giving yourself more insulin, right? That's correct, right? So you're pretty much
drugs to make more insulin.
What's that?
You can take drugs
To make more, oh, I see, okay.
to make more insulin. There are
understand.
drugs available
Okay,
now.
I understand. Okay,
that will stimulate your pancreas to make insulin.
Okay, but you have to be on medication. So we've got about a minute left. I'd like to finish with Tony Lee, and Tony, I really appreciate your telling us your story. What do you want people to know about diabetes, and particularly Native Hawaiian community? What do you want people to know about it that you think that will help them deal with it or avoid it?
Well, I always kind of attribute it to like we're born with the wrong deck of cards. It's in the genes and you can't avoid it, but you can delay it probably. I guess that's the proper way it's inevitable. It's going to get there. But the thing is to delay it and take care of yourself. Nobody taught us that as we were youngsters, and even as a diabetic now, when I go to the doctor for my yearly checkup and I've lost maybe 10 pounds, my doctor's concerned. I said, wait a minute, why are you concerned? You've been after me to lose weight. Oh, but that's too much.
Okay,
Too
so
fast.
Tony, thank you so much. You got your point across, and I really appreciate it. And I want to thank all of our guests tonight, and mahalo to you for joining us tonight. And we thank our panel of diabetes experts, Dr. Lori Tom, Dr. Marjorie Mao, Dr. Mariana Gershenson, and diabetes patient Tony Lee. Next week on Insights, the COVID-19 pandemic has made it harder to escape domestic violence. We'll discuss what help is out there for victims and what disturbing trends are on the rise. Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.